Happy Tuesday. We're just going to invite in Nawal. Today she's going to be talking about nerve. She has a craniosacral approach, and she also has a certification with the vagus nerve. So I think she's just connecting. Just give her 2 seconds. Hi, Nawal.
Hi, Sarah.
How are you?
I'm good. How are you?
Good, good. We're matching today. We're both in
matching.
Okay, so Nawal is the craniosacral therapist here at Humanity Wellness. We're very grateful to have her here. She's going to be answering some questions about her certification that she has. She has an extra certification with the vagus nerve, which not all craniosacral therapists have. So Nawal, please let me know, what exactly is the vagus nerve?
I'm glad you asked, Sarah. So the vagus nerve is a nerve that we have in our body. So in our cranium, in the skull, inside where is our brain, we have 12 pairs of cranial nerves. And one of them, the number 10, is the vagus nerve. It's the longest cranial nerve, and it comes out from the brainstem, which is at the base of our brain. And so it travels throughout our entire body. It's actually, vagus is also means the vagabond, like the wanderer, the traveler. So it's such a long nerve that travels throughout the body, from the brain to some vital organs like the heart, the gallbladder, the intestines, and fertility organs. So it affects your entire body. It can affect your ear, your neck, your tongue, and it also is known for having an impact on our autonomic nervous system. So
we're getting some likes as you're saying this.
Yeah, it's such a fascinating, important nerve in our body. And so yes, it has a direct impact on our nervous system. I'll get into this a little more later on, the sympathetic and parasympathetic, and also, like I said, on our vital organs, hormones, muscles, digestive system, mental health, and lifestyle. It's such an important
has a massive
nerve.
Impact on the entire body. So we've chatted a little bit. So what exactly in the vagus nerve, there is like a high tone and a low tone. So what exactly does it mean to have like your vagus nerve having a high tone versus a low tone?
So when your vagus nerve is not being stimulated properly, or is being stuck, so we refer to this as having a low vagal tone. So what we want is having a higher vagal tone. And so when you have a low vagal tone, vagal from vagus, that contributes to multiple disorders. So that's what happens in your body when your vagus nerve is not functioning properly. So you can have anxiety or intestinal problems, depression, eating disorders. It can have an impact on your social interactions as well. So having a high vagal tone is something that would help reduce anxiety, depression, inflammation in the body.
So it's important to have a high vagal tone.
We'd rather have the highest vagal tone. Yeah.
So I think that might be a little bit different from like the flight and fright response. So that's like your parasympathetic nervous system versus your sympathetic nervous system. So what is the role with the vagus nerve in regards to that?
Yeah, I love that question, actually. So this fight or flight, a lot of people know about fight or flight or rest and digest, and these are one of the autonomic nervous system functions. There are two, actually now there is something called the polyvagal theory. We are talking about a third function. Let's focus on, yeah, it's fascinating. It should have its own university, honestly. But let's focus today on the first two main responses that we all know. So I'll just dive a little bit on this one. So one of the responses is the fight or flight, as you were saying. So that's when we have a bit of a stress or we feel a threat. So the survival mechanism is activated, and then the adrenals get triggered. The body is mobilized to fight. Physically or verbally, or flee as well. That's another possibility. And So for example, you can just change the subject if you feel that the conversation is not making you comfortable. And or freeze, that's where the person would just simply shut down. And so what happens in your body is that your muscle, they start to tense, your legs get ready to run out, your heart races because you're trying to save yourself and flying or fighting a dangerous situation. Either you're being chased by your tiger or your boss is stressing you out. So these are the things that start to happen in your body, and it can have an impact on your digestive system. And so it provides your body with a burst of energy to fight and survive. So that's the fight or flight. Then we have the rest and digest, which is the opposite of that. That's when you manage to hide from the tiger, or you're not in the stressful situation anymore, you feel safe and you can relax. So that's the relaxation response, and you can rest and digest literally, because now that your digestive system is not shut down to go and fight the tiger anymore, you can literally digest your food and your emotions.
Amazing. Yeah, I see it a lot with massage therapy. When someone comes in and I can tell that their sympathetic nervous system is very elevated. And then as I would say around 15 minutes, it usually starts to taper, and the parasympathetic nervous system starts to come in or kick into place, which is very nice to watch. So what is the vagus nerve's role in trauma? I know I have a little bit of a vagal response with previous car accident over the Lionsgate Bridge, which you and me will work on in the very near future, because I want to be able to cycle over that bridge without having a vagal response. So what is the vagus, what is that response? Why does it
with
happen?
the vagus nerve to trauma?
With trauma.
So when somebody goes through an emotional or physical trauma, they experience either something overwhelming, upsetting, frightening. So we call that trauma. And so this is a whole body experience, as you know as well. And so that's when the body goes into what we were talking about earlier on. The body goes into the fight or flight or freeze to actually help you respond to the threat or the danger and keep you safe. It doesn't feel good. It's not a really nice thing to experience, but technically it's actually there to help you and save you. And so, so again, your body is immobilized, in order to respond to that, to the danger. And so, the body starts to respond through the sympathetic nervous system. So your body is into hyperarousal, just like you were describing. And so when we do some vagus nerve, we can bring the body out of this hyperarousal, hyper-awareness that is happening in your body, and allowing to switch from fight or flight to the relaxation state, where you can allow a feeling of safety, and so that there's more room for your body to start doing the healing, which is exactly at the root of cranio-sacral therapy work.
Amazing. Yeah, well, when I know I get a vagal response, it's out of my control, and I feel like I'm pretty good with controlling, just from my previous skating background, controlling emotions, controlling my heart rate, controlling respiratory, but I do experience the vagal response, and it's very difficult and challenging to actually overcome. So it's nice.
Yeah, it's your body's reaction.
Yeah, it's very interesting. Can you explain the mind-body connection with the vagal or the vagus nerve?
So your vagus nerve is actually your sixth sense nerve. It's your gut feeling nerve. When you have those feelings, it comes through that nerve. So, and there is, as we were saying at the beginning, there is a literally physical connection between your mind and your body, between your brain and your guts, through the vagus nerve. And so that's how, the brain and the guts are literally connected. And so through what's happening in your mind, it can have an impact on your guts. and vice versa. What is happening in your gut is having an impact on your thought, on anxiety or depression level. It is through this nerve. So that's why things such as breathing exercises, meditation, any form of prayers have a positive impact on your body, on your mind, and on your soul.
Amazing. Yeah, I think the next time we have an Instagram live, we're actually going to be doing an exercise that you can do that actually relax the vagus nerve through the training that you usually give to patients as like home care. Can you tell us a little bit about that before actually as like doing the next Instagram live? Just give us like a little snippet.
Absolutely. A little snip. So there are many ways to stimulate the vagus nerve. It's like a little bit of an exercise. These are really easy things for people to do. Sometimes we stimulate just the vagus nerve. Sometimes we have to help, and I'm not going to dive too much into it, but we need to help with other nerves in the body. So sometimes doing something with the eyes can have an impact on how great we can feel. But something that you can do right away, right now, it's easy for anybody. It's just taking a deep breath and making sure that the out breath is longer than the breath in.
Don't give it
and
all
that's
away.
No, that's another one. That's another one. That's another one. So you just breathe in deeply and breathe out even longer. And that's something that you can do anytime. It's a little tool in your pocket.
Okay, so anyone who's interested in watching an exercise on the vagus nerve, if they ever struggle with any vagal response, or I just had a friend had a baby choking and actually talked about freezing, that freeze that you were kind of talking about. I feel like a lot of people have potentially experienced these things. So spoiler alert, exactly. Next week we will be going over a vagus nerve exercise. Thank you so much, Nawal, for taking the time to answer some questions about the vagus nerve, as not everyone knows about it. And we will be seeing you next week.
Absolutely.
Okay.
Thank you, Sarah.
Thank you. Bye.
Bye.